name is Dr. Harish Vaja. I am a senior cardiac surgeon at Evercare Hospital Lekki. I am also the director of Cardiothoracic and Vascular Surgery in our hospital. So briefly about this gentleman, Mr. AWELE. He is in late 50s.
My name is AWELE Okonkwo. I had a little concern with my movements. I noticed that I was having a lot of sensation in my heart. At the time I went outside, I couldn't actually trek back to my car. So I thought something was wrong. I also got home and I discovered that I wanted to pick something from the kitchen, and I had a slight movement that almost threw me on the ground. Luckily for me, there was a wall very close to me. So I decided to come to Evercare. Since I've gone to many places, I couldn't get remedy. So I came to Evercare. I met Dr. Sharma. Eventually, they did angiography scan for me, and they discovered that 3 of the arteries supplying blood to the heart are not functioning properly.
He was initially consulted by Dr. Amit Kumar Sharma, and given his symptoms of angina, he was advised elective coronary angiography. This was performed at our hospital in our cath lab department, and he was found to have a triple vessel disease. He was given the options of either multiple vessel stenting in cath lab or coronary artery bypass grafting. He had chance to see me before he could make his final decision.
So I actually opted for the grafting. That's the one they call the bypass. So I did the surgery because I had a lot of talk with Dr. Harish, a very friendly person, and he also explained the situation to me, why I should go for the complex kind of surgery.
And eventually, after consultation with his family, he decided to proceed to elective coronary artery bypass surgery. He was admitted mid-June, and he underwent elective coronary artery bypass grafting ×3. So we used 3 bypass grafts. We used internal memory artery, which usually runs in front of your chest, and on the left side we call left internal memory artery. We also used his left radial artery, which is from the left forearm, and we tend to use the non-dominant hand. He was right-handed, hence we use his left radial artery as a conduit. And third conduit we use as a piece of vein from his right leg. And surgery went very well. He after the surgery he was extubated on table and subsequently transferred to ICU.
I came to Evercare on the 14th of June, and the surgery was performed. And I want to thank God that it was very successful. I didn't stay long in the hospital. I think I spent 7 days in the hospital. You can imagine that kind of complex operation.
He stayed in cardiac ICU for 3 nights, and then he moved to the ward. Again, his recovery in the ward was uneventful. He was fit enough to be discharged a week following surgery. At the time of discharge, his all surgical wounds were healing well. He has no problem. He was able to walk independently. He was managed to climb stairs supervised.
To a large extent, I've recovered very well. I can breathe well. I also encourage anybody that is having those kind of signs. People slum. You just hear somebody slum on the way and just died. These are some of you need to take time to come to Evercare. Just come in and do a test and see what is there. They have all the equipment. You don't need to travel outside Nigeria. I was actually planning to go to India, but everything went well here.
His symptoms of angina disappeared immediately after the operation. He has no further symptoms. I had followed him up after the surgery in our outpatient follow-up clinic, and he continued to do well. Today was his another visit, and again he is continued to recover well.
You have Dr. Harish, you have Dr. Sharma.
And this is for the viewers who are watching this video. that we can do all cardiac surgeries, including bypass surgeries, valve replacement surgeries, complex aortic root surgery, aneurysm surgery. So we have all facilities, consumables and support staff available in our Evercare Hospital. So I would urge all the viewers, do not underestimate your symptoms. If you have any symptoms related to your chest, difficulty in breathing, chest pain, please do not hesitate. Please contact us and to be reviewed by our cardiology team, and whatever decision is required, that can be treated very well within our institute.
My advice to people is, don't look at the big structure that you are seeing. This place is for you, because some people think because the building is very big, you can't afford it. Please enter, because it's like a big supermarket in the healthcare sector. Everything you see here, you don't need to go to a hospital where the doctors that will treat you, they are running from another hospital to this place. So here, everything is complete.